Brain tumors in teenagers and young adults are abnormal growths of cells in or around the brain. These tumors may be benign, non-cancerous, or malignant, cancerous, and can vary in severity, growth rate, and symptoms depending on their location and type. While brain tumors are relatively rare, they're a significant cause of cancer-related illness in this age group. Types of brain tumors in teenagers and young adults. The types of brain tumors commonly seen in this age group include 1. Low-grade tumors, benign or slow-growing, pilocytic astrocytoma, a common, slow-growing tumor usually found in the cerebellum or optic pathways. Gangliogliomas, rare, slow-growing tumors that may cause seizures. Craniopharyngiomas, benign tumors near the pituitary gland that can cause hormonal imbalances and vision problems. 2. High-grade tumors, aggressive or malignant. Medulloblastoma, a fast-growing tumor that originates in the cerebellum and can spread to other parts of the brain or spinal cord. Anaplastic astrocytoma or glioblastoma, aggressive tumors that arise from glial cells and require intensive treatment. Diffuse midline glioma, including DAPG, a rare and highly aggressive tumor in the brainstem. 3. Germ cell tumors, tumors that arise from embryonic cells, typically in the pineal or pituitary region. Examples include germinomas and teratomas. 4. Ependymomas, tumors arising in the lining of the brain's ventricles or spinal cord. Causes. The exact cause of brain tumors in teenagers and young adults is often unknown. However, some factors may contribute. 1. Genetic predisposition. Inherited conditions like Li-Fraumeni syndrome, neurofibromatosis, or Tickett syndrome. 2. Environmental exposure. High doses of radiation or exposure to certain chemicals, though rare. 3. Spontaneous mutations. DNA mutations during cell division can lead to abnormal growth. Symptoms. Symptoms of brain tumors in teenagers and young adults depend on the tumor size, location, and growth rate. Common symptoms include general symptoms due to increased intracranial pressure, persistent headaches, often worse in the morning, nausea and vomiting, unrelated to illness, fatigue or drowsiness, seizures, even in those without a prior history, vision problems, e.g., blurred or double vision. Location-specific symptoms: cerebellum, poor coordination, balance issues, and dizziness. Frontal lobe, personality changes, impaired judgment, or difficulty concentrating. Temporal lobe, memory issues, confusion, or speech difficulties. Pituitary gland, hormonal imbalances, growth issues, or delayed puberty. Brainstem, difficulty swallowing, breathing issues, or facial weakness. Diagnosis. To confirm the presence of a brain tumor, doctors use several diagnostic methods. 1. Medical history and neurological exam. Assess reflexes, coordination, and sensory/motor functions. 2. Imaging studies. MRI, magnetic resonance imaging, the most detailed imaging for brain tumors. CT scan, sometimes used in emergencies or when MRI is unavailable. 3. Biopsy. A small tissue sample is taken to determine the tumor type and grade. 4. Lumbar puncture, spinal tap, to check for tumor cells in the cerebrospinal fluid, especially in medulloblastoma or germ cell tumors. 5. Molecular and genetic testing. Identifies specific mutations or markers to guide treatment, e.g., IDH mutations in gliomas. Treatment. Treatment depends on the type, location, and grade of the tumor as well as the patient's overall health. Options include 1. Surgery. The first line of treatment for many tumors to remove as much as possible. Complete removal is often possible for benign or low-grade tumors. 2. Radiation therapy. Used for malignant or partially removed tumors. Proton beam therapy, a targeted form of radiation, minimizes damage to healthy tissues and is often preferred in young patients. 3. Chemotherapy. May be used in combination with surgery or radiation to treat aggressive or metastatic tumors. 4. Targeted therapy. Focuses on specific genetic mutations in tumor cells, e.g., BRAF inhibitors for certain gliomas. 5. Supportive treatments. Anti-seizure medications. to control seizures. Steroids, to reduce swelling and relieve symptoms. Prognosis. Prognosis depends on factors such as tumor type, grade, location, and response to treatment. Low-grade tumors often have an excellent long-term outlook, especially with complete surgical removal. High-grade tumors may require intensive treatment, and outcomes can vary. Advances in therapy and clinical trials are improving survival rates. Complications. 1. From the tumor itself. Persistent neurological deficits, e.g., weakness, vision loss. Cognitive or memory problems. 2. From treatment. Long-term effects of radiation or chemotherapy, such as growth issues, learning difficulties, or secondary cancers rare. Hormonal imbalances requiring lifelong replacement therapy. 3. Emotional and social impact. Anxiety, depression, and challenges with reintegrating into school or work. Follow-up and rehabilitation. 1. Regular monitoring. MRI scans to check for recurrence or progression. 2. Rehabilitation. Physical, occupational, or speech therapy for functional recovery. 3. Psychological support. Counseling and support groups to help with coping. When to seek medical help. Early diagnosis is crucial for better outcomes. Seek medical attention if a teenager or young adult experiences persistent headaches or nausea, unexplained seizures, sudden changes in vision, behavior, or coordination. Support for patients and families. Organizations like the Teenage Cancer Trust and Children's Brain Tumor Foundation provide resources, emotional support, and financial assistance for young patients and their families. With advances in treatment and early intervention, many teenagers and young adults with brain tumors achieve good outcomes and return to active, fulfilling lives.